Well, good evening. Thanks, Mike, for that introduction. I want to thank Riley, sitting in the back there, and Joel. Generally, there are audiovisual issues. Frequently, when I'm going to give a talk, I go the day before to make sure things are right. I just came an hour early this time, and those guys were here early, and we're taking off on time, which is great. So Rick Latham, who started the program here, was in the military with me. He was a year ahead of me in training at Brooke Army Medical Center in San Antonio, Texas. And he was actually my mentor for my research project to finish my fellowship. So Rick gave me a call in 2009, wanting to know if I wanted to just come up and maybe slow down some. And I said, no, but I'll come and help out. So for a week at a time, for a while, I would come so those guys could go fishing. And in 2011, he said, well, will you come to stay? And I said, well, I'll think about it. And I did so in 2012, April 2012. And I told my patients in Louisiana that I would be away for 3 years. And it's been 10 years now. So when I do go back to Louisiana, I don't go out very much because. So on this occasion, so last year when I spoke, I was given a topic to speak on. And this year they didn't give me a topic. So when I want to learn about something, I decided I'll give a talk on it. So it forces me to learn new things. So I thought I would talk about the aging heart. Presbycardia. And this impairment of cardiac function that's attributed to aging. Albert Einstein is also a hero of mine, and I don't think he made this statement, but it looks great next to his picture, that learning at all ages induces successful aging. So this slide's laid out of order. Let's skip this. And objectives will be to define aging, look at maximum lifespans, talk about the process of aging, limiting factor for the lifespan of cells, we'll discuss that. The importance of telomeres, list aging theories, some of those, and talk about the role of epigenetics, which is very important in terms of how we function, how we age, and how we may not age in the future. And how do you get to 100 candles? I put a pacemaker in a patient about a month ago, changed out a pacemaker in a local person here who was 104, doing fine, doing fine. And on the opposite end of the spectrum, I sent a 35-year-old for open heart surgery for multivessel coronary bypass because of clogged arteries just 3 days ago, and the surgeon sent me a text this afternoon saying he did fine, got 5 bypasses. So some of us age real fast because of the choices we make in life, or maybe for genetic reasons. And some of us age a lot slower. So if we define aging, it may broadly be defined as a time-dependent functional decline. And unfortunately, if you're gonna live, you can't stop it, right? So the alternative is to die. And it's this inexorable movement of life. It poses greatest number of risks for us, though. As we age, we're more likely to develop atherosclerosis, or plaque in arteries, coronary artery disease, hypertension, heart failure, heart rhythm problems like atrial fibrillation. On a daily basis, I see anywhere from 4 to 8 patients with atrial fibrillation. It's really a major problem for us as we age. Myocardial infarction, which we see at all ages. And over the past 2 weeks, I've had 2 65-year-olds come in with heart attacks. And I mentioned a 35-year-old also was a heart attack. One problem we're seeing now is that as time goes on, we're having parents to come in bringing their children having heart attacks. Because many, many years ago, food was food. But in probably the mid-'80s, we started eating a lot of things that weren't really food, like Pop-Tarts. That's not food. There's nothing in it that's food. The strawberries made at a perfume factory, really. So So we're having kids get sicker at a younger age. Cardiac hypertrophy, the heart enlarging, that's also a problem with aging in many of us. So here is the sea anemone, which is non-aging, does not age. Here is the Bristlecone Pine. Has anyone ever seen that, the Bristlecone Pine? Yeah, huh? Did you go to the Great Basin National Park to see it? So you can see it in the Great Basin National Park in Nevada, which is near the Utah border. So I plan to go. I may go in July, but actually. Be pretty hot, but. So it's 4.5 hours northeast of Las Vegas. I have a daughter in Las Vegas, so I'll go see her and we'll drive to see that. It's generally found in places where other things can't live. It's really a hardy plant. 5,000 years old. Yeah. This is in terms of the longest lived person, in terms of truly recorded, is this lady. This is Jean-Louis Comment, who was born in 1875 and died in 1997 at the age of 122 years and 164 days. This is a picture when she was 121. She did not have a very stressful life. I think she was only married twice. She ate a pound of dark chocolate a week. Now, I don't know that that had anything to do with it, but that's part of her history. And she did not go to a nursing home until she was about 100, when she almost burned the house down when she was forgotten, left the stove on or whatever. But when we look at mammals, or look at living creatures, a rat, thank goodness we have rats, right? They only live about 3 years. Chimpanzee, 59 years, and here's the longest lived person, 122 years. So scientifically, aging is a process that converts a optimally healthy person in a fit organism to one that's less healthy and less fit. Aging is a biological process. It's not a disease per se. It's not a disease, but it is a biological process. Aging can lead to reduced tissue physiological function, increase our susceptibility to disease. For instance, like with the COVID vaccination, it didn't work as well in older people. And then as we age, we're just more susceptible to disease because the immune system does not function as well. We have decreased resistance to stress, physical and psychological. So unlike pathological conditions, the aging process affects everyone who lives. So the process of aging is a continuum of throughout an individual's life. It affects all individuals. Number 3 may not be correct. A process that is genetically programmed may not be genetically programmed, but genetics plays a major role. It's modified by environmental influences, such as with this, the air quality can really be detrimental for some of us and actually increase our rate of disease and aging. But we only have about 3 months out of the year of bad air quality. So that's good. The rate of aging can vary widely among people. And physiologic aging in any given person may occur more rapidly and more slowly than the chronological age. So one may not look their age. It may not really be internally their age. So there's a test that we can do. And actually, I talked to a radiologist there about getting the cost down for this test from $500 down to maybe $100. It's called a coronary calcium score. And it's a great test for men 45 and older, women 55 and older. Women don't age initially as fast as men. They just don't. They don't calcify as fast for various reasons. So we don't need to do it in women under the age of 55, and women are more susceptible to radiation, so we wait. But with that test, it can tell you if you have coronary calcification. It can give you your physiological age. For instance, I had a patient the other day and was concerned about the calcium score, and this person, I think, was in in their latter 50s, early 60s, but the calcium score said that, no, you're more like 84 internally. You know, but what do? Well, if you have a lot of calcium in your arteries, you change your lifestyle and you reduce the amount of inflammatory foods in your diet. It's good to see you. I thought you were going to be out of town. It's good to see you. I thought you were going to be out of town. Dr. Till. Okay, so physiological aging can be much greater than your chronological age, or you may be a lot younger than your chronological age. So when do we begin to age? There was a study done looking at about 1,000 people born in New Zealand from 1972 to 1973, and we were looking at various parameters. They could determine that aging actually began probably in your mid-20s. Is when we start going downhill. Alex Carroll was a Nobel Prize winner, and he felt that a normal cell was immortal, that it could continue to divide and divide and divide and divide and make new cells. But we now know that that's not true. Hayflick determined that there's a limit to how many times a cell can divide. For instance, a mouse has about 15 cell divisions and lives about 3 years. The Galapagos turtle has about 110 cell divisions. 110 times a cell can divide, and it lives about 200 years. And for the human fibroblast, it can divide about 40 to 60 times. And as you know, the longest lived person was about 122, but on average, 80 to 100 years. The human body is designed to go 120 years unless we do things that will impair that, right? So there are things that we can do to let it self-repair. We're carbon-based, we can self-repair unless we smoke, we drink too much. Don't wear your seatbelt when you drive. I mean, there are things that you can do to shorten your life. There are things that we can do to get the most out of this life too. We should not get sick at 65. That's not, I mean, that's just like you're not taking care of your car. So Hayflick in 1961 showed that human cells divide about 40 to 60 times. And then when these cells stop dividing, they go into a period of senescence. They don't function properly. And it's been shown that with each mitosis, with each division, the telomeres, at the end of cells, the telomeres shorten. And as the telomeres shorten, the cells don't function the way they should. So what are telomeres? Well, we know that with each cell division, telomeres shorten. And telomeres is a region of repetitive DNA sequences at the end of chromosomes. Yes, one on each end, sort of 92 telomeres. And they protect the ends of chromosomes from becoming frayed or tangled. This progressive shortening of telomeres will lead to senescence, apoptosis, cell death. In the brain, the glial cells within the brain, when they begin to age, they don't filter out the trash that's formed, and then the signals don't fire the way they should, and then we have the onset of loss of memory and things that we see with Alzheimer's. So as the telomeres shorten, it affects the health and lifespan of an individual. So telomeres are repetitive DNA sequences. They contain thousands of repeats of the 6 nucleotide sequence, TTAGGG, thymine, adenine, guanine. And in humans, there are 46 chromosomes, and thus there are 92 telomeres, one at each end. So what is the implication of telomere shortening? Every time a cell reproduces, the telomeres shorten. Now, this is not true in cancer cells. In some cancer cells, they produce telomerase. And I think about 2 years ago, maybe 3 years ago, we had Dr. Michael Fossel come to speak, Fossel, come to speak here in Fairbanks, and he wrote the book, Telomerase, the enzyme that holds the key to aging and will lead to longer and healthier lives. And if we do develop telomerase, it's predicted that we can keep an individual healthy on average for 150 years. And may be able to reverse aging somewhat too. And there is research being done with that. They've taken the skin of older people and put it on a mouse and give it telomerase, and the wrinkles go away. But we just haven't found a big enough mouse for, but at any rate, so. So this is really interesting in terms of, this is in Fossil's book, The Hidden Rocks Analogy. That is, when we are young, when we have these long telomeres, we can abuse the body and get away with it. But for instance, with the 35-year-old who came in, who was a heavy cigarette smoker, but also had very high triglyceride level above 1,000, that person developed problems before the age of 40. But as we age, we become more susceptible to having high cholesterol, high blood pressure, and doing things that we shouldn't do, like smoking, and eating the wrong foods. So as we age, we are more susceptible to disease. So telomere shortening may be what causes aging. There's wear and tear, just with just the injuries we have that we sustain throughout life. Free radicals, reactive oxygen species, may damage cells and cause aging. DNA damage for radiation exposure, and reduced stem cell function can also cause it. As we look through genetic theories, I want us to focus on the last two, that aging has been linked to length of telomeres, but also DNA methylation can cause aging also. And we're going to spend some time talking about methylation and why it's important. Yeah. More than a chicken, less than a grape. Yeah, more than a chicken and less than a grape. So that's the human genome. We have more genes than a chicken, but we don't have as many as a grape. So when you look at chromosomes, now this is something that, that's interesting to me. If you look at the bottom XY, see how much larger the X chromosome is than the Y chromosome? And women have two X chromosomes. We have Y. And it may be why, I'm saying this jokingly, but maybe why men don't live as long as women. Because of the Y chromosome, we do things like this. Or here. And I think this is the last one. It's because of that Y chromosome, trust me. We do things. Yeah. So years ago, like around 1990 or so, we thought that we had 100,000 genes from research. But as time has gone on, we now know that we only have about 20,000 genes. And we know this because of the Human Genome Project, which began in 1990, and it concluded in 2003. And so we now know that we have about 20,000 genes. But in terms of how our genes function, it's over 200 million ways because of what happens with, here we go. Here's the influenza has 11 genes, E. coli 4,000, fruit fly 14,000, chicken 16,000, here we are, 22,000. So more than a chicken, but less than a grape that has 30,000 genes. But how our genes function and how we can get more out of our genes is through epigenetics, which is a study of changes in organisms caused by modification of gene expression rather than the alteration of the genetic code itself. So we can modify how the genes are expressed. And that is very important because how much we sleep, whether we exercise or not, things we do in life can change, can turn on and turn off genes. Strawberries help us to live longer because of the methyl groups that it gives. Blueberries help to fight cancer because of what it does with methylation. So epigenetics has transformed the way we think about genomes. And we look here at the epigenetic mechanisms. Here's a chromosome, here's this methyl group that would attach to certain portions of DNA, or the methyl groups will affect histones. Now histones are very important because DNA is wrapped around the histones. In fact, if you take the DNA that's wrapped around the histone and stretch it out, it'll be like 3 kilometers long. So that's how much wrapping we have around histones. So here we have the histones, and DNA is wrapped around it. And when a methyl group binds in certain areas, the histones would allow DNA, certain portions to be exposed so that the genetic code can be read. Or it can turn on good genes, or turn on bad genes, or turn off bad genes, or turn on good genes, depending on what the factor is that's affecting it. So histones are proteins that form a core particle around in which double-stranded DNA is wrapped, and they're susceptible to covalent modifications. So we don't need to go into too much detail with that. But here's an article that I saw recently titled Epigenetic Modifications in Cardiovascular Aging and Diseases. So we're learning more. And I'll show you, I think put the slides in, from 15 years ago, when there was a hint at some things about genetics and cardiovascular disease. But now we're finding, well, what is it about the genetics that causes us to age? And what about these epigenetic modifications? So when we were young, with a nice, small, energetic heart and clean blood vessels, as we age, plaque develops, and the heart enlarges and the muscle thickens. So there's histone modification of the histones allowing the gene to be exposed. We'll see this again in another slide in terms of where this area is repressed versus when it's opened and causing problems. So different forms of RNA can cause remodeling of the histones and the DNA and can turn on or off good or bad genes. So this is from like 15 years ago when I was lecturing to students about what happens if you take a normal muscle cell and you give it a stimulus, you stress it in some way. That cell may have genes that are turned on that would cause it to die because it can't handle the stress. Or there may be a genetic flaw there that would cause that cell to respond in such a way that the person develops what's called Hypertrophic Cardiomyopathy when there's certain stresses in life. Or with weightlifting or exercise, you may get what's called concentric hypertrophy, where the muscle thickens, and that's not good because the heart becomes stiff. Or if it's an athlete, you may get what's called physiologic enlargement, hypertrophy, and that's in response to exercise. Or you may get a heart that's worn out and dilated and just can't keep up. And it's an enlarged chamber, and we call that eccentric hypertrophy. And there was this mention of increased expression of embryonic genes. And 15 years ago, I kind of wondered about that. Well, okay, this there, so what? But now we know this is so what. So MIR 217, this is microRNA 217. And then if you just look at that quickly, the first thing you see is it talks about it being an oncogene and has something, a lot to do with cancer. But then a little further down in small print, it has an issue with cardiovascular disease also. So this is new data and finding out that this gene also plays a role where when this gene is activated, it turns off another gene which was repressing bad genetics. And when this is no longer repressed and the histones open up and allow the DNA to be exposed, then one can develop pathological transcription and develop thickening of heart muscle, plaque and arteries. You're more susceptible when these repressors are turned off. So certain stimuli would cause that. And so the issue, though, is that how do you turn it off and on? It has to do with methylation. And we're just beginning to understand this in terms of what's causing it. The next step is to say, well, how do we prevent it? And of course, you can make it happen by certain things, and we'll talk about some of that. Same thing here, where this repressor, when it's taken away, get destabilization of the cardiac gene expression, activation of chronic inflammation, myocardial pathology. So this is active research been going on, and that we're going to hear about more in the future. This is interesting. It's kind of complex, but I'm going to make it somewhat simple. This is a catecholamine, something that stimulates the heart. For instance, another patient I just saw who was drinking. Oh, yes, another person who had a heart attack. He was out drinking energy drinks. And And I thought only kids did that really, but this guy was in his 60s. But 60 is young, right? Old age starts at 65. But that's young old. And there's some beauty in the young old, because in the young old, you have a lot of life experiences, and you know how to have fun without getting into trouble, right? And then the middle old starts at 75. And the old starts at 85 in general. So the young old should have a lot of spunk, and even the middle old. We're not old until 85. But that energy drink or something that stimulates the heart can stimulate the beta receptor. If you overstimulate this receptor, it will stop functioning. And we see this in stress, in the broken heart syndrome, stress cardiomyopathy. If someone gets the heart overstimulated, the heart weakens. If you have a surge of adrenaline, that is not good. We also see this with sleep apnea. When someone has sleep apnea and the blood oxygen level is dropping, you get a surge of adrenaline, and that overstimulates the heart, and the heart will weaken with time. Or if you have atrial fibrillation and the rate is real fast, you get what's called a tachycardia-induced cardiomyopathy, because these receptors are overstimulated. When these receptors are stimulated, there is a release of calcium from the calcium channels that would cause the heart to contract. So these receptors are very important. Here's an example of an agonist is stimulating the beta receptor. When it becomes overstimulated, this tail end of the receptor becomes phosphorylated, and it will not function. It will not couple with the agonist. It becomes internalized, and if it stays internalized too long, the receptor is digested, and the heart doesn't function well. It becomes extremely weak. So in a normal heart, if you're not abusing it, the receptors function well. In heart failure, we have too many of the stimulants, a lot of the catecholamines, and the receptor is not responding because it's phosphorylated. In the aging heart, what's quite interesting is that, yes, we see a lot of catecholamine there, and many older people can't rest, can't sleep because of the overstimulation that we're getting from catecholamines. But the heart is failing, and it fails, and not because of phosphorylation, not because of that. And we don't know why yet. That's why there's a question mark here. There's stimulatory proteins, and there are inhibitory proteins. The inhibitory proteins are more prevalent in older people and in the failing heart. We do know this, that, I don't have a slide here, but beta blockers tend to reduce the amount of that inhibitory protein in terms of the cell being inhibited. So frequently we do use beta blockers in people with heart failure, and it helps the heart to become stronger again. I haven't seen any data saying that we should give beta blockers just to stop the heart from aging, but it makes you wonder. But we shouldn't do anything unless it's been studied. So what happens when the cardiovascular changes with aging? Well, the heart is not as elastic. It becomes stiff. This results in an increased afterload of the left ventricle. Blood pressure goes up. The heart thickens. It doesn't relax as well as it should. Atrial pacemaker cells are lost and drop out. The heart becomes fibrotic and scarred. Decreased responsiveness to the receptors. And as we mentioned, the catecholamines increase. So with isolated systolic hypertension, we really should keep an eye on our blood pressures. And it's not always white coat syndrome. Most of my patients say, well, it's white coat syndrome. And unless you want to get in an argument, you just say, okay, but look, I want you to monitor your blood pressure, bring your cuff in, whatever. But if you're stressed at the doctor's office, it always makes you wonder, are you stressed when in 5 o'clock traffic? Or are you stressed when you go to the Fred Meyer? Or are you stressed when someone's sneezing on you and doesn't have a mask? Are you stressed because of all the reasons and is your blood pressure elevated? So normal blood pressure is below 120/80. Stage 1 hypertension, if the systolic pressure is above 130 or diastolic above 80. And stage 2, systolic above 140, above 90. So these are the norms for blood pressure. But when are we over-medicated? If you're taking medication for high blood pressure and your diastolic blood pressure, the bottom number, if it's below 60, you may be over-medicated. And that's just dangerous, more dangerous than having elevated blood pressure. So keep that in mind. Diastolics that are consistently below 60, you may be volume depleted, dehydrated, or over-medicated. Systolic dysfunction and heart failure. So what do we see? See, I told you, audiovisual, these guys are good. So this heart should be squeezing almost completely, but it's very weak. This is what we see with systolic heart failure. That ejection fraction is less than 20%. And if this person isn't treated, 50% chance of dying within 2 years. That's the type of hearts we would normally send for a heart transplant. But with some of the newer medicines that we have now, we can reverse this. Diastolic dysfunction and heart failure. So this is a patient, and these are patients that, here, so this is a patient with apical hypertrophic cardiomyopathy. At the tip of the heart, there's a lot of muscle here, too much muscle, and the heart becomes stiff and doesn't relax well. And we call that diastolic heart failure because the lungs become congested. Atrioventricular conduction defects. So this is the patient. These little complexes here, this is from the primary pacemaker, and you have many more of those than you have of the larger ones from the main secondary pacemaker. So this is a person with heart block. The primary pacemaker is trying to drive the heart about 104 beats per minute here, but it's only going 36. And actually, this was a tourist from about 4 weeks ago and passed out in Denali Park and came in, and we put a pacemaker in this person, and he did quite well. So we see that too with aging. Dysrhythmias, well, we see a lot of this. Atrial fibrillation, right? Very irregular. The atrium is contracting about 400 times a minute. Or we see atrial flutter with atrium is contracting about 300 times a minute. So these are common dysrhythmias. And aortic valve calcification. Here's the aortic valve. It's really heavily calcified. And a recent change in what we can do, it used to be that, and in fact the textbook would say, no matter how old you are, if you have severe aortic stenosis, that person can go to surgery. Well, you know, now they don't go to open heart surgery. Many of the patients have a TAVR, or in Europe they say TAVI, transaortic valve implantation. Just get a valve put into there to replace that valve or to push that one aside. So you don't have, patients go in to get this fixed now. It used to be you would go in, you'd been in hospital for 7 to 14 days. Now they go in one day, have it done, and go home day 2 or day 3. You know, it's amazing how the technology has changed in terms of taking care of valvular heart disease. But aortic stenosis is another epidemic in our country right now with aging. So the plain truth is there's no single food, no exercise or supplements, certainly not supplements. You know, in terms of supplements, vitamin D, D3, over the counter, maybe because we don't get enough sunlight. The UV index in Fairbanks is less than 3, September through May. So the angle of the sun is just not steep enough, so we don't make enough vitamin D. If you have blue eyes and blonde hair, you can make vitamin D much faster than anyone else. You can make vitamin D when the sun's high enough in 15 minutes. Whereas if you are a black sub-Saharan African, it would take an hour and a half to make the same amount of vitamin D. But the trade-off is that African can stay out without burning. And so that's the trade-off, right? So vitamin D, it may be reasonable to take it from September through May. In the summer, though, don't take it. Get 15 minutes of sunlight or some sunlight before you put the sunscreen on, before you put that on. Because when you do use sunscreens, you don't make vitamin D. And vitamin D deficiency is a problem throughout the world. In the early 1900s, they put vitamin D in soap, they put it in beer, and they just did anything that people would buy, which we don't need to do. If you go to a tanning salon, you don't need to take vitamin D. And if you do that 5 to 10 minutes, 2 or 3 times a month, you make a lot of vitamin D. and probably don't have an increased risk for cancer if you're just doing that. But if you don't go to a vitamin salon and you take vitamin D, you may become vitamin D toxic. So, but there's some things you can do to increase your chances of staying healthy longer. So how do we get to 100 candles? What do we do? Well, you don't have to be a scientist. You don't have to know any of this at all to get to 100 candles. But what you may want to do is to do what the centenarians do. Live the way they live. It's more than just how you eat, but it's how you live also. I mean, for instance, you can be on a very healthy diet, but if you're stressed out all the time and always complaining and fussing and fighting, and I mean, your free radicals are going to be off the charts and you're going to age quickly. We can see what stress does to a person, right? Every president who goes in looks a lot older when they come out, right? But they do, I mean, it's true, right? But stress is dangerous. There is stress cardiomyopathy. I gave a talk many years ago on sudden death on Monday. And when I was researching information for that, I ran across an article that had a study of, it was about 7 people who had autopsies who were murdered. And when they looked at the heart, there were new infarctions. There were microinfarcts from the stress of what was going on. So the surge of adrenaline is damaging to the heart. So we should really calm down. If something upsets you, just get away from that. Sleep on it and deal with it the next day in a much calmer demeanor. I'm practicing that. I really am. But the centenarians, the Blue Zones, Dan Buettner, Dan Buettner came to our home and he spoke, I spoke, and whatever, and Dan told us, he lectured on the Blue Zones. And he's with National Geographic. Went around the world to find the places where people live, where you have a lot of people who are 100 and older. And so the places were Sardinia, and the men drink red wine about 3 times a day. They walk about 5 miles a day up and down hills, tending goats. And they do drink goat's milk and some cheese. Have a plant-based diet with small amounts of red meat. The Sardinian women carry the guns, and they take care of the business. So the men don't have much stress, right? And Loma Linda, the Seventh-day Adventists are the healthiest people in the United States. They various nuts, vegetarian with an early light dinner, and they drink plenty of water. So we do have information from there. They've done 2 trials. And one thing that was learned by the Seventh-day Adventists is that if a man drinks at least 5 8-ounce glasses of water a day, you reduce your risk of a heart attack by 50%. All right, so that's your minimum, 40 ounces a day. So drink plenty of water. In Okinawa, Aoreachibu, meaning stop eating when you're about 80% full. Don't overeat, you know. So when Dan Buettner came, we took him to a restaurant called Bistro on the Bayou. You know, and you heard about Louisiana food. And Dan looked over at me and said, "No Aoreachibu tonight, buddy." You know? So to put Dan into perspective, his girlfriend was Cheryl Teagues. You know Cheryl Teagues? Yeah. Some of us are old enough to know Cheryl Teagues. So, but plant-based diet with soy. All right, Costa Rica, hard water, largest meal in the morning, lighted salted corn tortillas, beans and squash, not much meat, some eggs. And when I met him, they were researching Ikaria, Greece, to see if it was a blue zone, and it was a blue zone. So why do they call it blue zones? Well, when they were researching this, in an area where they found people that lived to be over 100, they circled that area with a blue pen, and call it and actually his first book was called The Blue Zone. And they were sued, National Geographic was sued by some other entity that had that name, Blue Zone. So they changed it to Blue Zones. And someone gave me a copy of his book early on, and it had Blue Zone, you know. I didn't give it back, I kept it. You have to tell the truth too when you get to a certain age, because you don't have many more times you're going to be forgiven, so I'm telling the truth to keep the book. All right, so yeah, Icarial grease was being researched and was found to be a blue zone also. Well, are you going to exercise or not? So use it or lose it, right? So sedentary people lose a large amount of muscle, about 20 to 40%, 6% per decade of lean body mass. And you can't maintain that with aerobic exercise. You have to do some resistance exercise too. So resistance exercise is important for us to do also. But now you have to be sensible when you do this, because when we get to a certain age, we don't stretch. We tear, things fall off, they break. So don't go to the gym and overdo it, right? Be sensible. But I wanted to get a slide from you to showing you riding your bike. I'm sorry I didn't get, I thought about it. Yeah, so Bud is an avid bike rider and he exercises a lot. And so yeah, don't smoke, diet, and exercise. So here's a study looking at leisure time physical activity in people with coronary artery disease. And now, I think this study was done in Germany, published in 1993. What's interesting about this study is that in the group, so they did cardiac catheterizations that found plaque in arteries. And they intervened on one group, another group, they said, well, just do what you want. And a year later, they repeated the cardiac catheterization to see what they were found. And what's interesting is that in the intervention group, the diet was 15% protein, so low protein, high complex carb, and 20% fat. And they looked at energy expenditure. If you exercise for greater than 2,000 calories a week, so let's say that you walk 5 miles a day, 4 days a week, well, each mile is 100 calories. You know, so you get to 2,000 calories just by walking 5 miles a day. You can do other things too for calorie expenditure. But there was 28% regression in the intervention group who exercised more than 2,000 calories a week. In the control group, only 6% had regression. No change in plaque in 62% of the intervention group, where no change in 49% of the control group at exercising, burning more than 1,500 calories a week. And progression of disease in 10% of the intervention group, 41% of the control group, if you exercise less than 1,200 calories a week. But so there was more exercise in the intervention group, but the diet was different too. So that's important. Exercise, but a sensible diet also. Here's a study looking at 130,000 people published in 2017, high income, middle income, low income countries. Both recreational and non-recreational physical activities were associated with benefits. So you don't have to go to a gym. Just be active, do things, move around. And so some of the non-recreational activities were transportation, housework, occupation, certain occupational things they would do also. And then what they looked at is, did you exercise for less than 150 minutes a week or greater than 150 minutes? So low physical activity was if you exercise for less than 150 minutes a week, or burn less than 600 metabolic equivalents. That's MET minutes. For instance, when you walk on a treadmill, if you are, when we get to, we start at 1.7 miles per hour, and then we go to 2.5 miles per hour. 1.5 miles per hour, 1.7, you're burning about 4 METs. And it's okay, but how long do you do it? So MET minutes. But to make it simple, exercising greater than 150 minutes a week had benefit. So what are some of the things? Like less than 3 METs, metabolic equivalents, how much oxygen you're burning. So a person sitting at rest doing nothing, we call that 1 metabolic equivalent. Whereas if you're walking slowly, there's 3 METs. Sitting at a computer, depending on what you're doing at the computer, I guess, is 3 METs. But walking briskly, 4 miles an hour, 3 to 6 METs. If you're shoveling snow, bicycling, 14 to 16 miles per hour, basketball game, soccer game. A lot of people play pickleball. I don't know, how strenuous is that? Yeah. Okay, well, so we probably get close to 6 METs maybe. And you play with teams, right? These 2 people don't, yeah. But I have quite a few patients who love pickleball. So what did they find? Well, in the red here was high physical activity. There was a mortality benefit for everyone whether it was moderate or high, okay? So just being active was very important in patients. And then, in fact, when we look at whether you were at various groups, age above or below, above 50, less than 50, BMI above or below 25, no matter what the situation, physical activity favored improved outcomes. You can exercise too much. You can. I mean, it's dangerous to exercise, but it's more dangerous to not exercise, right? So here's a study from Mayo Clinic, 2012, from Dr. O'Keefe, looking at people who were, had high-intensity training. So we know that if you're exercising anywhere from 1 to 5 miles per hour, there's benefit. There's less mortality. Drops. There's a 10% benefit. If you are exercising at 6 miles per hour, there's even more benefit in terms of the hazard ratio of mortality goes down even more. And then at 7 miles per hour, it goes down to 73%. But if you're running like a marathon and you're averaging greater than 8 miles per hour, then you lose what you would have gained. We do know that in high intensity training, particularly when running a marathon, if you run it fast enough, the right ventricle, the right pumping chamber is weakened for about 3 weeks. We also know that in high intensity training, ultramarathoners and others who do high intensity training, the blood vessels thicken and they actually calcify. So one can exercise too much, so we should be careful about that. So what about successful aging? Well, enjoy life. It is meant to be enjoyed. Maintain physical function, maintain mental function, continue to learn. Avoid disease. That leads to, these things will lead to successful aging. The doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent with nutrition. That's Thomas Edison said that. And here's an old ancient Egyptian proverb: 1/4 of what you eat keeps you alive. The other 3/4 keeps your doctor alive, okay? So be careful. Take care of yourself. So we're ready for questions now. Yes?
Stenosis is a major problem. Stenosis? Romel, if you could just repeat that.
Yes. Yes, stenosis is a major problem. So when we say stenosis, we mean narrowing in a blood vessel, plaque in arteries. And actually, I'm glad you did ask that, because it's not so much the plaque, it's when the plaque becomes unstable. The average person having a heart attack doesn't have 90% narrowing. They have only 50% narrowing, maybe 40%. But the plaque becomes unstable and it ruptures. For instance, one way to make a plaque really unstable is to, between 10 p.m. and midnight, go to a fast food place and get a burger and a shake. Not an Impossible Burger, I don't think, but I've been known to get an Impossible Burger, but not at 10 o'clock because they're not open. But yes, inflammatory foods, right? Like simple carbs, soft drinks, and things. I'm going to mention it, not that I need to for this group. But for instance, I had a patient who was dabbing. You know what dabbing is? Oh, that's that real strong marijuana. And came in. So when people do that, and there are shops around for the butter or dab, or I have to look it up to even know myself. That can cause a heart attack. It's not very common with marijuana, but if you do the really strong stuff, you can make plaque become unstable. So stenosis or narrowing is a problem, but you can stabilize plaque, which is important. So having it is not as much of a problem as letting it become unstable. Does that answer your question? Okay. Yeah. Yes, Ava?
You mentioned that in order to get enough vitamin D, going out for 15 minutes before you put on sunscreen would be, enough. Do I need to go out in my Speedo?
And so you have to show some skin. That's a great question. You have to show some skin. And maybe not that much skin, but show some. That's another thing, too. When you go out and you're sweating, you're out in the sun, you're not supposed to go in and wash that off. So go in and get the sensitive areas, but let the sweat stay there for at least 6 hours, some say overnight, because the vitamin D needs to be absorbed. It's on the surface of the skin, it needs to be absorbed. There's another thing, too, about vitamin D is that it helps to prevent skin cancer. It's an antioxidant. Whereas the vitamin D that you take by mouth never gets into the skin. So it's not preventing skin cancer. All right. Generally, when we give you something, it's a trade-off. I mean, it's better to be natural. But don't be so natural that you say, no, I'm not going to treat the high blood pressure with your medicine doctor. I'm going to take garlic. I'm going to do this. I'm going to do that. Well, okay, if it works, but don't do it knowing that it's not working. Like we'll have a patient come in with a blood pressure of 220/130, which we see sometimes. And that's stroke range. But they don't want to take what we prescribe. So frequently I get the answer. I had a question today, why did you become a doctor? And I said, well, I really wanted to be an electrical engineer, but when I was finishing high school, electrical engineers were being laid off throughout the United States. I can tell you which year, but I don't know if you really want to know that. So I was in honors chemistry and with 12 other kids, and 8 of those kids were kids of doctors, and they were going to go into pre-med, and I was grading their papers, so I figured if they could go to become a doctor, I could do that too. So I went into pre-med chemistry, and that's how I became a physician. But at heart, my point is that we are physicians, but we are scientists. And we love learning, and some of us love teaching, and it's evidence-based, okay? And we love keeping people alive. And so you can live a long time and do things. So when we say, well, I take this, it's not because we don't sell drugs. Doctors were not allowed to own drugstores a long time ago. So, because sometimes, human nature, it's hard to be human, right? Yes?
How much vitamin D?
Great question. Boy, I get worried when I see someone come in taking 10,000 IU. Brigham and Women's did a study about 3 years ago, looking at people throughout the United States and also throughout the world to find out, do we need to take vitamin D? Because we still don't know if we should tell people to do that. They had to choose a safe dose. The dose they chose was 2,000 IU daily. Yes. So 2,000 is safe. Generally, I take 6,000. Why? Because I'm a person of color, and it takes me longer to make vitamin D. But so if you're taking 6,000, it's probably not going to be too much. 10,000, I worry, but I've had some people who are high levels at 10,000 and some who were not, because there are issues sometimes with absorption. But 2,000 is safe. 5,000, I don't think is too much. Okay? Yeah. D3, over the counter, not the prescription stuff. That's not as good. Yeah.
Okay.
Yes.
So what are the major symptoms of not enough vitamin D?
Yes. So, we do know that vitamin D is very important in terms of immunity, bone health. One major problem with vitamin D deficiency is that if you develop low calcium levels, your parathyroid gland will get turned on. And we call that secondary hyperparathyroidism. And the parathyroid gland takes calcium from your bones to bring up your serum calcium level. And so that's caused by low vitamin D levels. So that's one major thing. So bone health. And you've heard of like rickets, with kids would have that who are vitamin D deficient, and bow legs and that sort of thing. So bone health is very important. But we know vitamin D plays other roles too in terms of just overall health and immunity. But what's really proven is the health of your bones. And later in life, so it's good to take it so that you don't develop secondary hyperparathyroidism. Now, what level is dangerous? a good level is 30 to 80. If it drops below 80, and we say someone's vitamin D insufficient. If it drops below 22, that's not so good. But generally, we don't see problems unless it's below 22. All right, but 30 to 80. And then there are some who feel that no, the vitamin D level should be maintained very high. I have wondered in some young people that I have seen with cancer who had low vitamin D levels whether that had anything to do with it, but I've just kind of wondered that. But generally, have you heard of John Mcdougall? He's a health guru in Santa Rosa, California. Yeah, Mcdougall. So he's excellent, and he believes in eating a lot of starch and whatever. But Mcdougall says he would never give a patient vitamin D. He would never do that. But he's in Santa Rosa, California, you know? And what they found in the study from Brigham and Women's is that at the end of the study, it said, well, the answer is complex. We don't really know if we should tell people to take vitamin D. However, if you live in an area where there's not enough sunlight, it's reasonable to do it. And, you know, another thing that's interesting is the insurance companies do not want us to measure vitamin D levels. You know, you have to pay for it out of pocket when it's done. So I see people, and I see young soldiers who have been here for 2 years, have never taken vitamin D. I know they're vitamin D deficient. And we check the levels, they're low. And so I sent a letter back to the primary care and said, please put this person on vitamin D. You know, because we really need it. But yeah, I think, did I answer your question? Okay, good. Yes.
So I have been told a couple different things about vitamin D. One, that you should always take it with a meal so that you have some fat, or otherwise it doesn't dissolve or doesn't absorb.
Yeah, so I would have to research that. You know, just yes, to know in terms of what pH is better, and you know, I would tell you that I haven't paid attention to that. When I have taken vitamin D, and my level goes up quite well, you know, and I think also too there's issues about taking some magnesium along with it, and there are a lot of things, but I would have to research that, but. I do know my level has gone up with taking it and without paying attention. I'm not saying you not to pay attention, but I would have to, you know, and I would be glad to research and get back with you, but you'd have to give your name and email to maybe my daughter.
Your pharmacist could answer that question.
Yeah, it's true. Well, yes, sure could. Yeah, that's great. Now, a pharmacist, and I love pharmacists. I mean, they are dear to my heart. And I say that, but let me tell you why. Because I have to tell the truth. My father was a pharmacist, you know, and I just loved looking at his books when I was a kid. I really did, you know, about the different, for instance, sometimes I'll give an order to a nurse and I say, well, get a patient, I want the patient to have 10 grains of aspirin. 10 grains, you know, so no one talks. Yeah.
Doctor, you want to repeat this, but you talk about magnesium.
Mm-hmm.
Can you talk about magnesium?
Yeah, so we see low magnesium in 4 situations. We see it in alcoholics. We see it in someone who's just malnourished. We see it in diabetics, and we see low magnesium also in people who are taking diuretics, fluid pills. Generally, that's when we see low magnesium. And then we replete it. And now, unfortunately, the magnesium that's inexpensive, magnesium oxide, MagOx 400, only about 20% is absorbed. So we have patients take 400 twice a day or whatever. And there's some other formulations that are better, as Sunshine Foods has. But yeah, so in general, one does not have to take additional magnesium unless you're a diabetic, unless you're taking a diuretic, a fluid pill. And we don't want you to be an alcoholic. And we want to make sure people get enough food. So. But those are the situations where we see low magnesium. Yeah. Yes, sir.
Can you talk about the role of fasting?
Oh, that's great. Yes. Well, actually, I invited Joel Fuhrman. You ever heard of Joel Fuhrman? Yeah. Nutritionist, right? He's a nutritarian. So Joel was coming. And He was going to come in August of 2020, and I think the COVID issue was like February, March 2020. So we had to cancel it, but we're going to have Joel Furman come. And Joel and I have emailed each other for years. And I said, I want you to come talk to us about fasting. He said, well, yeah, fasting's okay, but I want to just come talk about reversing heart disease and reversing diabetes. So we're going to have him come, and the hospital was willing to pay for that. He's going to charge $10,000 for a day. But we can come up with that, right? I mean, you have friends at the hospital, don't you? But anyway, so it's going to be a community thing. So about fasting, have you heard about mitochondrial hormesis? Mitochondrial hormesis, have you heard of that?
I've heard you talk about it.
Yeah. She has to listen to what I talk about it. So, she has to put, so a hormetic is something that will stress the body, but you get a good response. Fasting will cause stress, but you get a good response. In fact, the mitochondria become more resistant to oxidation, more resistant to free radicals when we fast. Vitamin E, some vitamins are not vitamins, they're actually hormetics. That is, if you do too much, it would hurt you. But just the right amount, and you get a better response. So when one is going to fast, it's safe to do it without any assistance for up to 72 hours. If you're going beyond 72 hours, there should be a healthcare provider involved to monitor your electrolytes. There are different things that happen, like with fasting, you really don't need as much water. But electrolytes can become out of order with fasting. One has to be careful. So generally, there should be someone overseeing it. And if you're on medications, it's not safe. Frequently, it's not safe to fast if you're on medications because the absorption, metabolism of those drugs can change too. But yes, I think there's different ways of doing it, right? Some people will do with just fasting for 12 hours, but that sort of thing. But yeah, it's been shown too that you can slow down aging with fasting. There was an article that came out probably 6 years ago showing that in primates that didn't work. And someone brought the article to my office because that person was so happy to tell me that fasting. But then now that's been refuted, and yes, there is evidence that we can improve health with fasting, without a doubt. And there are various authors out there that write about it, and I think it's a neat way to start losing weight, and especially when you have someone to do it with, it's a lot of fun to do. Well, it is. So did you fast? Did you do it? Are you fasting? Yeah. So
Maybe it's like 2 meals a day instead of 3.
yeah. So
You get this 12-hour break.
yeah. So there are facilities where you can go and fast for like 5 to 7 days. Caldwell Esselstyn, who wrote the book Prevent and Reverse Heart Disease. Yes, I spent a couple of days with him, and he told me that he wanted to go to that facility in Santa Rosa, actually, California, to do a 5-day fast. Also, he was looking forward to doing that. I don't know if he ever did it or not. But I think that's something that we should do that.
You can do it.
Yeah. But I want to do, I mean, life has to be, so look, Bud used to be a hang glider.
Yeah.
Excitement, you know? Fasting can be like that. Yeah.
No. Everything else you said is spot on, but not so much.
Okay. Yes, sir.
Doctor, he was talking about 2 meals a day, and that's basically what I do. The other thing, I told you I was on my pastry diet also.
So let's talk about how many times you eat a day, really. There's a diet, a book that was written, I think it was, I don't know if it's by a psychiatrist or not. No, it's an endocrinologist. It's called the leptin boost diet. Leptin. So leptin is a hormone that tells your body you have eaten and it's time to burn those calories. And in this book, this endocrinologist says that most of his patients who are overweight only eat once a day. Because the body can go into that starvation mode where leptin levels go down. And so he proposed that you eat 3 meals a day, and in between those meals, snacks. So you're eating 6 times a day to turn on leptin. So there's so many different ways that we can do it the right way. There are different ways of doing it, especially if you're active and you're exercising, right? Like the Olympic swimmers who are just lean, they eat 20,000 calories a day. They eat an awful lot, but they're burning those calories, right? So I'm not really a proponent of saying that one should only eat once a day or whatever, because I do know that it's better to eat your largest meal early and your lightest meal later. We know that's what we should do. But there is a role, I think, too, just with fasting. But personally, I think that's one way of just doing something different, It's just good for your mind. And I tell people at work, look, food is overrated. And think about those young soldiers who have to be out there and don't, I was a soldier once. Okay, I was a better doctor than I was a soldier, but I recall going out in the field, and I went out in the field only once because I realized that was not the place for me. And we were out in the field for 3 days in Fort Polk, Louisiana. And no one wants to go to Fort Polk because it's the armpit of the Army. So I'll make the story short. But I was out there, and in the Army, you are not supposed to be out in the field, and by your 3rd day, you're supposed to get a hot meal. But you get rations up to that point. So on the 3rd day, it was barbecue chicken, potato salad, and I wasn't vegan then. And got my plate, I was gonna sit down, and they said, Doc, you gotta go. This soldier passed out. They took my plate, I never got one bite. I had to fly on a helicopter with a guy who had passed out back to base. So, so you think about soldiers who don't get a hot meal. So I don't, if I miss a meal, I'm doing procedures or whatever, I don't care that much about that. But it's not really healthy. I should eat a nice breakfast and, decent lunch and that sort of thing, which I'm gonna do when I retire. But yeah, and no pastries. So if you eat animal protein less than once a month, your body behaves like you're vegan, So we can have it, but not very often. And if you do eat animal protein, it should be wild, like wild salmon, moose, caribou, wild. Because it's grass-fed, it has more omega-3 fatty acid. Highly processed is a problem. We know that. Yeah. And not being active.
Maybe out of respect for people's time,
Yeah.
2 more questions, and then
Yeah.
and those who'd like to stay in chat, Doctor.
Oh, sure.
Okay.
Yeah, but
A couple more questions.
I think we covered it all. Yes. Hi.
Hi. Back when you were talking about the telomeres shortening,
Mm-hmm.
and you said, we have 60.
Yeah, 40 to 60 divisions. Some of us only have 40. Some you probably have 60 plus, but
Yeah.
go on.
But
Yeah.
after you have, does the body, does your heart do 60 the same time your liver does 60, the same time your brain does 60, or do they?
That's a great question because not every tissue has divisions. That's another thing that's complex about this. Like many of the neurons in the brain never divide. And cardiac muscle, once it matures, doesn't divide. There can be some healing. So we have some tissues that don't divide, whereas the liver does a great job, right? We can remove 2/3 of the liver and reroute the blood flow, and it regenerates, and grows, right? So, but not every tissue has cell divisions, yeah, which is a great question, which is one thing that's complex about this telomere business in terms of what we can possibly do with aging. Personally, I think we're going to learn more about DNA methylation. In fact, it was stated that you can measure your telomeres to know how long you're going to live. Well, now we know it's not quite accurate, whereas it's more accurate to see how methylated you are, But I wouldn't order those tests and that sort of thing, because a lot of it right now is that people just trying to make money off us who are kind of interested. So live a healthy life and don't worry about it. And that's what I say, right? The rest of it's just fun. Some people have fun by doing drugs. I don't do drugs, so I have fun by learning. You know what I mean? There's different ways to have fun, and the main thing is to enjoy the life. And if you want a long life, if you like your friends and your family, you want to hang around, eat in a healthy way. That's the bottom line. And then exercise. Yeah.
Last
Yeah.
question for Dr. Romel, Wrenn. Maybe a big hand for one of the
Thank you. Thank you.